Well, I have the distinct honor of introducing our Deputy Mayor for Health and Opportunity and the Health Commissioner for the City of Philadelphia, Dr. Donald Schwarz, this afternoon. Don and I have been colleagues for over 20 years. I had the good fortune of meeting Don when he was Chief of Adolescent Medicine at the Children's Hospital of Philadelphia, and I was invited to teach the pediatric residents about adolescent gynecology, and it's always been a pleasure to work with Don. Don really wears many hats. He, in addition to his work in the Department of Public Health, he also oversees the Department of Human Services, Department of Behavioral Health and Mental Retardation Services, and the Office of Supportive Housing in the city. But he really began in academics here in Philadelphia and was a professor and vice chair of pediatrics at the Children's Hospital of Philadelphia. He also was a senior scholar in the Center for Clinical Epidemiology and Biostatistics at Penn, as well as a senior fellow in the Leonard Davis Institute of Health Economics. He's a very highly regarded researcher, especially in the area of adolescent risk behavior, issues of injury, prevention of injury in minority communities, as well as public policy approaches to adolescent violence. We heard a wonderful plenary session talk yesterday afternoon with one of Don's colleagues, Geraldine Radcliffe, on a community-based intervention to improve the outcomes of high-risk infants. Dr. Schwarz has also served as president of the board of directors of the Philadelphia Citizens for Children and Youth. He's been a member of the Governing Council of the American Public Health Association and a board member of numerous local and regional community agencies. When Don was appointed as the Commissioner for Health in the city of Philadelphia, I was so pleased. In fact, I was ecstatic, and I contacted him immediately. And within a few weeks of his appointment, he met with the chairs of the departments of obstetrics and gynecology in the city of Philadelphia. And the reason I was so pleased was I knew we had someone who was not only incredibly intelligent, but so thoughtful, and he was an outstanding listener. And I knew he would be willing to sit and talk with us and listen to us about our concerns about maternal health in the city of Philadelphia. Don Schwarz recognizes that if we're going to improve the health outcomes of infants and children in this city, it begins with the mother. And we have forged a partnership with Don, and we are working to improve access to prenatal care in the city, as well as providing prenatal care to undocumented immigrants who are uninsured. It's a big leap to go from academics to a position in the city. Don was a brave man to jump ship, but I think he also recognized that this was a real opportunity, because if we're going to improve the lives of mothers and their families, it's going to take a partnership between academics, the community, and the city. And so we are so fortunate to have an individual like Don Schwarz to work with in this city. Don?
Thank you, Debbie. Dr. Driscoll and I, as she mentioned, have known each other now for about a quarter of a century. And she was 17 and I was about 21. I am delighted to be here, and I want to begin by acknowledging, as I'm sure you all do, both the leadership and the vision of Dr. Afaf Melis, our Dean of the School of Nursing at the University of Pennsylvania. She came to talk to me about this conference now, maybe 6 months ago, and her excitement was infectious. What was most remarkable to me was her sense that we in Philadelphia and cities around the world have so many common ways that we could learn from each other and address and ultimately improve the lives of women. And I believe her career has shown that substantial progress can be made when people both across disciplines and across nations come together and put their minds to figuring out how to solve very, very difficult issues. So congratulations on today and the events that have gone on this week. And to all of you who are here, thank you for being in Philadelphia. It is your work and your inspiration and your new ideas that I hope will allow us to make substantial progress in the lives of women here in Philadelphia and women around the world. It is particularly exciting for me at this time in Philadelphia when, as you'll soon hear, we have a mayor who both understands at a cognitive level and believes at a deep personal level that the only way the city of Philadelphia will maintain its role as a great city in this country and in the world is if we are attentive to and thoughtful about what we need to do to promote the health and improve the lives of women in our population. I do believe, and I wouldn't speak for him, but I do believe one of the chief environmental factors in the lives of women is often men. And he will talk a bit about, I hope, the environmental changes we're making in men in Philadelphia, as well as other parts of the environment for women. One of the particular issues that I want to mention, because it relates to the Department of Public Health here in Philadelphia, that is most exciting to me, is that there is in the United States now a national initiative called Communities Putting Prevention to Work. It is a large $370 million undertaking by our president to identify within cities in particular and other large communities around this country best practices and fund new ways to use those best practices to change environments and change policy within government to improve health, particularly in two areas, one being obesity and two being tobacco use. In Philadelphia, both obesity and tobacco use increasingly disproportionately affect the lives of women. So we are engaged, having been awarded just last month one of 44 awards, or actually 2 of 44 awards, to undertake this work. So Philadelphia now has about $25 million and a very detailed plan over the next 2 years to institutionalize within government and partner within our city to change environments in ways that make a difference both to obesity and to tobacco use. For obesity, Philadelphia has been a leader in the nation here. When the request came from the Centers for Disease Control in September, we were pleased to see that almost a third of the referenced best practices around obesity prevention had happened first in Philadelphia. The researchers are here, the impetus is here, community-based agencies and partners are here, and we believe that we will be able to do many of the things that I think you've heard about in the last few days. So we are tactically bringing fresh fruits and vegetables into communities in Philadelphia which have not seen fresh fruits and vegetables for 30 or 40 years. We have what the First Lady in this country refers to as nutritional deserts. Large areas of Philadelphia where the only thing that is available is highly processed and packaged food, to the point where we have children in Philadelphia who, when shown a fresh tomato or a fresh sprig of broccoli, have no idea what it is. Up to half of children believe that a fresh tomato is an apple. So, in this city, which is one of America's greatest, we know that the overall rate of obesity and overweight among our children is about 56%. And in areas that are particularly poor in Philadelphia, 70% of our children are overweight or obese. That number has increased consistently over the last 30 years. When I began work in Philadelphia at the Children's Hospital, I saw in my first year, I have always kept a database, two children with diabetes that wasn't type 1 or the genetic form of diabetes. 2 children who had diabetes due to obesity. In Philadelphia now, about 8% of our children are diabetic. That is an enormous number of children. And it's 12 to 15% of our adults. Of those who are diabetic as adults, diabetes is disproportionately affecting women in Philadelphia. I spoke with the director of obstetrics at one of the other hospitals in Philadelphia. We now have only 6 places in the city where women can deliver a baby. That may seem like a lot for many of you, but 15 years ago we had 19 delivery locations in the city. At one of those very large delivery locations, they have just replaced all of their delivery room beds because the weight capacity for those beds was 350 pounds, or about 150 kilograms. And now, upwards of a quarter of the women coming in for delivery are, they anticipate, going to be over the weight limit for their tables. So they are all being replaced. You may know that the city of Detroit recently replaced all of its emergency transport vehicles because the back doors and the tables in the vehicles were too small for the population of Detroit. In one of the treatment facilities in Philadelphia for adolescent girls with substance abuse issues, the facility closed for a year and a half in order to remove all the door frames and replace them with wider frames because the girls and staff couldn't easily pass through. So we are seeing in Philadelphia an epidemic that affects children and women disproportionately, I believe, particularly those who are poor. And we will address it not only by bringing to them, for the first time in a long time, food choices that are healthier, but also by making the public have for themselves different tools for understanding their nutrition. It begins in schools. We are partnered with the school district here on a comprehensive curriculum to teach children how to understand nutrition and how to begin using fresh and healthy fruits and vegetables in their diet. That includes interpreting nutritional information both on products and menus, because Philadelphia now has the nation's strongest menu labeling law. So that not only do we have for chain or fast food restaurants requirements that calories are posted when someone walks in at the point of order or on the menu, but we require sodium, carbohydrate content, fat content, and trans fat content, as well as, if I didn't mention, sodium, on every menu or available at the point of order. And I will share with you, because many of you, both in the United States and around the world, have many of the same chain restaurant institutions that we do, that I previewed the menu information for all of the restaurants. And while I was somewhat aware of the caloric content, I was stunned by the sodium content. So that there are places in Philadelphia and around the nation where one can order a sandwich that has almost 7 grams of sodium. The adult daily maximum healthy amount of sodium is just 2 grams. So by eating one sandwich in this establishment, someone will ingest 3.5 days worth of sodium content. That's an adult. So imagine what happens for the child who eats a large size portion. So we have taken on menu labeling in a major way. We have banned trans fats in all food-producing establishments. And we are in the process, under the mayor's leadership, of being the first city in the country to tax sugar-sweetened beverages. It's controversial. The mayor can tell you as much probably as I can about the controversy, but we're in the process of going neighborhood by neighborhood in Philadelphia to educate people about why we would even think of taxing the precious commodity that is sugar-sweetened beverages. And I have to say, it's been an extraordinary conversation. I have been at more community meetings in the last 3 weeks than I thought possible. And generally, they start off relatively hostile, with people asking, why would you increase the tax on us? And my response is to talk about sugar-sweetened beverages. And I have to say, I have learned a lot about sugar-sweetened beverages: Coca-Cola, Pepsi-Cola, ginger ale, root beer, and the rest. So I didn't know, and I'm embarrassed to say, that a 20-ounce bottle, which for many of you from around the world is horrifying to think about, a single-serving 20-ounce bottle, but it's become the norm in the United States. A 20-ounce bottle of sugar-sweetened beverages has the equivalent of 14 packets of sugar in it. For parents who get anxious when their children put 2 or 3 packets of sugar in a beverage, to know that one serving, from their point of view, of a sugar-sweetened beverage is providing 24 packets of sugar for their child is quite a persuasive argument. In addition, I talk about what the impact is in the ways that I've mentioned to you on what's going on with deliveries in Philadelphia, what's happening to the furniture in hospitals, what's going on in terms of our ability as a nation to deal with the health care costs associated with diabetes and cancer and so forth that are related to obesity. And people are horrified. And by the end of these sessions, 201, I have found people supportive once they're informed about why we would increase the cost of sugar-sweetened beverages. Perhaps the greatest concern has been that taxing sugar-sweetened beverages is a regressive tax. That is, proportionately, it is harder on the poor than it is on the wealthy. And I can share with them that in this nation, those who are poor are much more likely to be obese because their opportunity to eat nutritious foods is so limited. And therefore, obesity is a regressive disease. And we are fighting a regressive disease with a regressive tax. My hope is that what this tax will do, if passed in Philadelphia, one, it will set the stage for other taxation across the nation. And two is, it will give us the opportunity to directly address this disease in poor communities, and particularly in single-parent families that are headed by women who don't have the resources to feed their children the kind of food that they wish. The second thing that I have learned is that over the last 25 years, the relative cost in this nation of fresh fruits and vegetables has increased dramatically faster than the consumer price increase, the consumer price index, while the relative cost of sugar-sweetened beverages has been kept low. We as a nation subsidize high fructose corn syrup production, and the large corporations that produce sugar-sweetened beverages have been able to market their beverages at a sufficiently low rate that children in this country now drink more sugar-sweetened beverage each year than they do milk. Water in Philadelphia is thought of as a toxic substance. For many of you around the world, you appreciate, in a way that we have forgotten, the value of clean water coming from the tap. Water in the United States is drinkable, it is healthy, and there is no reason why children aren't drinking water. We've calculated that if an average family in the United States which drinks at least 2 liters of sugar-sweetened beverage at dinner, replaced on 2 nights a week, that 2-liter bottle of sugar-sweetened beverage, just 2 nights a week, the family will lose 24 pounds a year. It's a lot of weight. So we're excited around obesity. And the other initiative is around tobacco. And the mayor is on his way and will be here. I want to introduce him by talking about tobacco. We are the city in the nation that has fought the trend So unlike the other large cities in the United States, rates of cigarette smoking in Philadelphia have increased every year for the last decade. In other cities, rates of tobacco smoking have declined, but by being the poorest city in the country, we have seen increasing rates so that now almost 30% of the population in Philadelphia reports smoking cigarettes. We know that although cigarettes are illegal, 20% of our small retailers sell cigarettes, it's illegal to sell cigarettes to children. Almost 20% of the establishments, small establishments in the city, continue to sell cigarettes to those who are underage. We are about to, with the federal funding that I mentioned, undertake a campaign around the city to enforce laws that exist, because we have good laws, around the sale of tobacco products to minors, so that we anticipate within 2 years we will no longer have retailers who are selling to children. We already have sneaky young people employed by government who go in and try to purchase. We have not had in this city the ability to do anything about the findings. So you may know the cardinal rule in public health: don't screen if you can't do something. Well, we are now about to do something. We will be able, with federal money, to begin to make a difference to retail sales to children. In addition, we will continue to enforce and continue to increase both the penalties and the education of retailers and the general public around tobacco use. I'm excited about the potential. I should say that in both of these initiatives, one of the reasons why Philadelphia was funded is that the government in Philadelphia was reorganized 2 years ago. So that I'm a deputy mayor. We didn't have deputy mayors more than 2 years ago. We now have 5 of us. Each of us has a portfolio of departments that cluster together. But what having 5 of us means is we have content experts who can work together on solving public policy problems. The reason we have this structure is because 2 years ago, Philadelphia elected a new mayor. That mayor was elected with a plurality of votes in every area of the city, for the first time for a mayor in more than 50 years. He was and is wildly popular in the city and came in and won with a progressive agenda that said public health has to be one of the key components of policy in the city of Philadelphia. We need public safety, we need public health, and we need education in this city. And all 3 affect children, all 3 affect those who are most disadvantaged, and all 3 are critically dependent on improving the role of women in our society. If we address structurally and we address through policy what we do for the lives of women, we will, as Philadelphia, both maintain our position and improve our position as a great city. It is my great pleasure to introduce my boss, who is the finest mayor in the city of Philadelphia.
Don, thank you very, very much. I don't know what you could have possibly said for 20 minutes, but good afternoon, everyone. Sorry to be running so late. Today is the 3rd annual Philly Spring Cleanup. So we have about 20-some thousand folks out right now cleaning up Philadelphia. This is, as I mentioned, the 3rd year in a row that we've done this. So I had a bunch of running around to do and tons of folks to thank, but I absolutely, positively had to get here, of course, to the International Council on Women's Health Issues Conference. We are honored beyond imagination that you're having this conference here, and I'm going to talk a little bit about some of the things that are going on in Philadelphia. And I appreciated Don's introduction, but it is without shadow of a doubt, and I certainly don't need any notes, the finest health commissioner in the United States of America is Don Schwarz, and formerly of CHOP and physician-in-chief, just when we met a couple years ago, we talked about restoring Philadelphia's health department to the height of where it had been some years ago. Philadelphia was considered many years ago to have the best health department in the United States of America. We're now actively, aggressively checking on other health departments in other countries around the world. We might want to capture some of that space as well. But there's not a doubt in my mind that the leadership that we've received from Don Schwarz in a variety of areas, some of which I'll talk about, a few of which I'll talk about this afternoon, would not happen without his great leadership. I also want to thank Dr. Melise for the leadership that she has provided for a long, long period of time, and please recognize her as well. Absolutely. Always good to be on Penn's campus. I was on campus just the other day for some census-related activity. You know that this is 2010. This is the year of the census. Everyone here filled out their census forms. Very good, very good crowd, very good crowd. I wanted to recognize our great Penn president, Amy Gutmann, who continues to provide great leadership, not only here at Penn, but for colleges and universities, not just here in the United States, but all across the world. I've mentioned to the president a couple times since I'm a Penn grad, and my wife, Lisa, is a Penn graduate school grad, let me do that now, and I'll make some other comments later. My wife, Lisa, and our daughter, Olivia, are both here with us today as well. Two very strong women, and I'll have some other comments about that later. But I've mentioned to President Gutmann on a couple occasions that since being mayor for the last 2 years or so, I have absolutely positively been on Penn's campus more in my short 2 years as mayor than I was for the entire 4 years of my undergraduate experience. So it's just been a beautiful thing, as they say. Let me thank the board members and the committee members. Conferences like this, meetings like this just don't happen. It takes a lot of planning, a lot of engagement, and so please recognize all those who helped put together this 18th International Congress meeting. One of the reasons we're so proud that you're having this conference here in Philadelphia is, quite honestly, it enhances our presence on the international stage. You've hosted these conferences literally around the world, in Brazil and Sydney, Australia, and Botswana. And so we're honored that you would consider being here in Philadelphia, having this conference. Philadelphia is a leader on issues related to healthcare, first hospital in the United States of America right here in Philadelphia, and many others. Our research and medical institutions are widely known. People literally come from around the world to get treatment right here in Philadelphia. We're a leader here at Penn of research institutions bringing in grants from a variety of funding sources. And so we take medicine and health very seriously. You know, a couple hundred years ago, and it was true then and it's true today, Philadelphia is a true melting pot of the United States of America and the world, an incredibly diverse city, many different people, many different languages, many different cultures, influenced all by the ethnic heritage that folks have brought. And what I remind my fellow Philadelphians is that unless you are an American Indian, everyone here in the United States of America is an immigrant. Doesn't matter how you got here, some came by majestic ships, and others came on some very cramped ships, and came for different reasons at different times. Some folks wanted to come, and some people were kind of brought here and didn't know what they were coming to. But we're all here now, and that's what really matters. And getting to know each other and understanding that we are all united in one race. That's the human race. And understanding that we have very few real differences between and among us. And there are some certain basic things that all of us want to see. We want our children to grow up healthy and strong. We want to live in safe communities. And we want to move forward in a way that leads us on a good path. And so many traditions remain, and we celebrate those traditions. We want to get to know each other and where we've come from, why we have the various perspectives that we have. But we also want to send the message out, and having, again, this international conference here helps to resend the message that Philadelphia is an immigrant-friendly city. Cities, the great cities in America that have shown population gain are those cities that have been much more welcoming to immigrants. And increasingly, people are getting to know this great treasure of a little place that we call Philadelphia. Our city government, we're in the service business, and it's one of the reasons why I signed an executive order saying that no city, department, or agency can ever refuse service to any person who is a resident here, regardless of what their status is. I don't work for the INS. I work for the city of Philadelphia, and we're going to provide service to people. So, you know, you'll get your paperwork straightened out. I've, in the government at least, banned the use of certain terms that others refer to folks whose immigration status may not be particularly clear. Here, we're going to serve folks, and we'll let other people figure out the paperwork situation. Our responsibility is to break down barriers between and among people, not sustain them. Philadelphia, of course, like many other major cities in America, though, has its challenges, one of which is 24% of our citizens live below the poverty line, 24%. And that is a great, great challenge, especially when it comes to issues related to health and the overall welfare of our citizens. We believe that the safety net in Philadelphia plays an incredibly important role in supporting many of our fellow citizens. And so partnerships with the Commonwealth, partnerships with the federal government are incredibly important. I created a new position in our city government to better align all of our social service agencies, although many others across the government that people had for many, many years operated as, I'm the commissioner of this, and I'm the commissioner of that, and I'm the commissioner of the other thing, and all I do is what I do. And so therefore, I created a new position in our city government called the Deputy Mayor for Health and Opportunity. And so the Department of Human Services, the Office of Supportive Housing, Behavioral Health, all of the agencies and departments that are part of an incredibly important social service safety net are now under the singular jurisdiction of Deputy Mayor Don Schwarz. That's what this is all about. It's about providing service and not having people go off on their own missions and their own agendas, right as they may think that they are. We want to work with these agencies in an alignment that allows policy to be driven by the mayor's office down through these organizations and for the purpose of getting things done. And so I mentioned my family a little earlier. I kind of hijacked them over here because we were out at the at some of the cleanup stuff, so they kind of really didn't have a whole lot of choice. But left on their own, they actually come to many things with me. I grew up 20 blocks away from here at 55th and Larchwood. I am a born, raised, educated, created all my trouble kind of guy right here in the city. I've never lived anywhere else. I've been fortunate enough to travel to a few other places, but this really is my home. Son of a very strong-willed and determined mother, father to a 15-year-old, 15 going on 25, and husband to a very smart and powerful wife in her own right. Issues related to women's health are very prominent to me, and I pay attention to those issues. Also, of course, try to convince these, you know, very manly men and strong guys and slightly a little more testosterone than they know what to do with, that they also need to pay attention to their health as well. But for today, we're talking about women's health. And so there was a powerful call to action issued by Cheryl Wooden and Nicholas Kristof in their book, Half the Sky, talking about what happens with women and a variety of different issues when it comes to issues related to equal opportunity that can have a debilitating impact on mental health. In the United States of America, we unfortunately continue to have a number of circumstances that directly negatively impact women. Equity in the workplace and equal pay for equal work is still a major challenge in the United States of America. but so is domestic violence. And we've taken, of course, a very strong public no-tolerance attitude toward domestic violence. It is something that I talk with men about all the time. Most cases do involve male action against female. There, of course, are a few instances where it may go the other way. But for the most part, this continues to be one of the worst scourges in American society. Our President Obama, has declared this month, of course, as National Sexual Assault Awareness Month. This is something that is a national issue and must be dealt with at the national level, then work down through states and, of course, cities and counties all across the country. Recently, Vice President Biden, who was in town yesterday and will be back in town today, said that the Violence Against Women's Act, which he was a sponsor of and championed when he was in the Senate, has reduced domestic violence by 58%. But yet, even with that reduction, there are still more than 2 million injuries a year and more than 1,000 deaths nationwide due solely to the issue of domestic violence. This is an issue that we must grapple with, and it has a devastating impact, not just on the woman who may be involved, but certainly on the children and the rest of the family. These are scars that, in many instances, will virtually never heal. We have had some changes, though. When we look at issues related to discrimination, a practice where some states allowed insurance companies to declare domestic violence a pre-existing condition and therefore would not provide service. And here in Philadelphia, nonprofit groups that work with rape victims have developed very strong partnerships with our Philadelphia Police Department, who also, with the great leadership of Police Commissioner Ramsey, takes this issue very, very seriously. Our Special Victims Unit has been upgraded. They've changed many of their policies and procedures and now operate one of the most open and transparent units anywhere in the United States of America. Our police detectives in the Special Victims Unit are quickly investigating and clearing many of the reported rape cases. Let me give you just a little bit of information. Our clearance rate for rape cases is more than 70%. The Philadelphia Police Department, the highest among big cities in the United States of America. And their overall work in the Special Victims Unit, their clearance rate is 80%, which is also, again, one of the national leaders. Our Department of Human Services. Now, normally when we talk about public safety, you hear great things about the police department, you hear about what the fire department's doing. I want to talk about the Department of Human Services. They're also in the public safety business. And let me tell you how they do that. We've made huge strides recently under the great leadership of DHS Commissioner Anne-Marie Ambrose with regard to dependency placements. They're down 13%, while at the same time, we've increased adoptions by 25% just in the past year and a half. And Anne-Marie Ambrose and her team are doing a tremendous job with an agency that had been troubled for many, many years, could not seem to get it together. And with her leadership and Don Schwarz in his deputy mayor's position, our main job is to protect children and do our best under every set of circumstances to keep families together. But if we can't, make sure that those children are in a safe, nurturing, and strong environment that care about them. We work very hard through our Chief Education Officer to be focused on all of our young people as it relates to school, but with a particular emphasis on making sure that girls stay in school, and graduate from high school. And of course, as this is kind of not just a Philadelphia audience, so I won't say as I always say, but I'd like to remind audiences, especially those filled with young guys, that there's only one woman known in history who ever had a child without a guy directly involved. Only one. All others have help. And so, no, women don't get pregnant by themselves, okay? And talking to these young fellas, there is a message that we have to communicate to them, that they have a responsibility as well. It's not just all on the girls. Guys have, of course, an incredibly direct involvement. Our Education Support Center is a new partnership between the Department of Human Services and the Philadelphia School District. Again, works to ensure that young people are able to get through their education, even if they're being served by the Department of Human Services. Lastly, two very important initiatives going on in Philadelphia right now, one of which has attracted some amount of attention. I'll leave it at that. But the CDC recently granted Philadelphia a $25 million grant in two parts, $15 million to deal with the issue of obesity and $10 million for smoking cessation. I've had the great pleasure of leading the charge on a smoke-free Philadelphia. 6 years I worked to create a smoke-free environment here in Philadelphia, and we're literally saving lives here in the city. But we have much more work to do. And with regard to obesity, the very sad facts are that 57% of children, school-aged children in Philadelphia, 57% are overweight or obese. For adults, the number is 64%. And for African Americans and Latinos in Upper North Philadelphia, 70% of the school-aged children in those communities are overweight or obese. This leads to explosive numbers with regard to type 2 diabetes, stroke, cancer, heart disease, and an obese child is much more likely to grow up to be an obese adult. It's driving healthcare costs through the roof, but even more important than that, it is contributing to a degrading quality of life for all of those individuals. And we've also been told, and you know this is a health organization, so I know you know this, but we can't overemphasize the fact that this generation of children may be the first in the history of the United States of America who will not outlive their parents. So the issue with regard to sugar-sweetened beverages and a tax, expanding our tax on that particular product, only in Philadelphia could you have so much controversy about something that makes so much sense. Philadelphians love change as long as it doesn't affect them at all. We're very serious and very focused on this particular issue, and there's no reason in the world why we should not be able to change behavior. I'm not anti-soda. I didn't have a bad reaction to soda. I'm not on a soda mission. What I'm on is a health mission in this city, that we can actually do something about these issues, and in public service at least, when you identify a problem, and it's something that you can do something about. I took an oath to look out for the citizens of this city, and I'm going to maintain my oath and my commitment to the citizens of Philadelphia in these particular issues, no matter what the controversy or who comes along.